Hi, everybody. My name is Cristina Besada. I'm the chair of Neurorradiology in the Hospital Italiano de Buenos Aires in Argentina. And I'm going to show you the value of tractography for demonstrating intertemporal anatomic connections. Our purpose is to demonstrate the value of tractography as a method of excellent anatomical resolution to make the observation in vivo of fibers and fascicles that link the neocortex of both temporal lobes, and to highlight and to encourage to the neuroradiologists the usefulness of this technique to evaluate the complex anatomical systematization of the human brain, in this case focusing on the commissures. To do this, we review clinical cases of our practice with chronic lesions such as lobectomy and trauma that are very frequent, and we perform tractography and focus on cerebral commissures. We found degeneration of the commissural fibers in these patients and went to see if these findings were already reported. There are very few publications about classic anatomy describing these connections specifically between both temporal lobes through the commissures in the human brain. To find these reports, you must refer to great anatomical treatises of the past centuries, such as Dejerin, Popov, Ramon y Cajal, among others, and these authors made their descriptions by direct examination of injured brains with myelin staining techniques such as Guaikert. We were very excited to find out that the few reports we found were made in Spanish, that is our natal language, by the German-Argentine Neurobiological School, founded by the remembered Dr. Christopher Jacob and his disciples. Of course, they were made in Spanish. Dr. Christopher Jacob is a master in the same level as Ramon y Cajal, but the only difference is that he did not write in English, but in Spanish and in German. But we encourage to those doctors who are fond of history and anatomy to get into the links to find out the history of this remarkable doctor. I'm going to show you the anatomy. So this is a picture taken from the original book of Ramon y Cajal about the brain in man and vertebrates. And here, this is a freehand drawing of the anterior wide commissure in the rat, very well described by many authors who studied comparative anatomy of vertebrates. And of course, in vertebrate brain, half of the commissural fibers are made up by fibers coming from the olfactory bulbs, as you can see here. Of course, in the human brain, these fibers, the olfactory fibers, are much less developed. This is human anatomy, and you can see here the anterior commissure. And this is a zoom, and I'm gonna turn around a little bit to understand the anatomy I'm gonna show you afterwards. So this is the report of a patient made by Dr. Goldar, who is one of the disciples of Jacob. And these are psychiatric patients because they worked in a psychiatric hospital. And here you can see the anterior commissure with central degeneration. This is from the book of Ramona y Cajal I just showed you. And this is a parasagittal section showing the central degeneration or the degeneration of the central fibers, leaving without injure the peripheral fibers. These are the these ones coming from the olfactory bulbs that are not injured and much less developed than in other vertebrates. This is the other very interesting report, also by Dr. Goldar and colleagues, and this is the corpus callosum, and again, a sectional anatomic section showing the central degeneration. And also I want to show you, this is I want to introduce you Dr. Goldar and Dr. William Bradley, who came to Argentina sometimes. This is 2000, and he was very excited to meet Dr. Goldar in the Museum of Alienated Patients. He was so excited to see the work of this school in Buenos Aires. So just to compare the anatomy that I have just shown you with the tractography, look at the central degeneration in the tractography of the fiber tracking of these commissural fibers. And this is an example of the same in a patient with a lobectomy. And you can see the fibers are not complete. There's a central degeneration, and also in the commissures in the tractography. Very well depicted. So in summary, tractography, of course, is an excellent tool to recognize intertemporal connections, as anatomists have described. Currently, it allows us to see or to evaluate injured brains in vivo and to demonstrate the degeneration of secondary degeneration of fibers, in this case commissural fibers, with very good anatomical precision. And at last, we encourage neuroradiologists to reproduce these and other findings with the hope of helping to understand the complex systematization of the human brain. And well, these are the references I've shown you. And again, this is our team, neuro team. And I again encourage you to discover the so interesting history of Dr. Jacob and the neurobiological school, German-Argentine neurobiological school, that is very, I promise you, very, very interesting. Thank you very much.